Hello everyone. I am really honored to be part of TOBI2021 as one of the best and largest symposium in the field of orthobiologics and orthopedics and sports medicine. The purpose of my lecture today is to present to you a study, a prospective one, comparing Leukocyte-poor PRP+HA and Autologous microfragmented adipose tissue in patients with early knee OA. I have nothing to disclose for this presentation. The purpose of this study was to compare the clinical efficacy of repeated doses of Leukocyte-poor PRP+HA to a single dose of Autologous microfragmented adipose tissue in patients with early OA. We hypothesized that Leukocyte-poor PRP could be superior than AMAT at 1 year in patients with early OA. 80 knees in 50 patients were randomly allocated into 2 equal groups in an unblinded design and prospectively followed for 12 months. Group 1 received 3 injections 1 month apart using Leukocyte-poor PRP+HA. Group 2 received a single dose of AMAT injection. Outcomes were measured by prompts using Tegner, Marks, Bass, and Kuss pre-treatment 6 and 12 months. We included in this study patients aged less than 75 years with knee pain, with early OA and body mass index below 30. We excluded patients with severe knee OA, viscosupplementation in the treatment site in the past 3 months, corticosteroid injection in the treatment site in the previous 6 months, history of allergy or rheumatological disorders. HA possesses viscoinduction properties, increasing joint lubrication and diminish inflammatory pathways in OA. PRP has been shown to modulate the inflammatory process by interacting with endogenous cells within the joint. More recently, a growing interest in preparation comprising HA and PRP combination has emerged due to its potential synergistic effects. In the group 1, the PRP was obtained from a single peripheral blood extraction, centrifuged by 5 minutes at 1,500 centrifugal forces. This system contained 2 ml of natural non-cross-linked HA and a 1.8-fold increase in platelets. In regards of adipose tissue, nowadays we know that this tissue has more MSCs than BMAC, with another type of cells, including pericytes, hematopoietic progenitor cells, pre-adipocytes, macrophage, that acts with an immunomodulatory and trophic and paracrine effects, reestablishing a regenerative microenvironment. We harvested 80 cc of fat, processed with a Lipogem device to obtain 7 cc of AMAT, and injected by suprapatellar approach. Both groups showed statistically significant improvement at 6 and 12-month intervals. Kuss Sports and Activity Daily Living subscale, AMAT group fared better but with no statistical significance. Group 2 showed better results, statistically significant, in Tegner and Kuss symptoms at 6 months and Tegner at 12 months. Many studies published in the literature recommend the use of HA and PRP for OA. With the use of adipose tissue, international multicentric studies showed good results in patients with early OA at 2 years. There are also studies showing the same results at 3 years. In conclusion, Leukocyte-poor PRP+HA and AMAT lead to clinical and functional improvement at 12 months. AMAT showed better results in Tegner and Kuss symptoms at 6 months and Tegner at 12 months. Understanding which therapy offers the most benefit with the least amount of risk can significantly improve the quality of life for millions of people affected with OA. Long-term randomized control studies are needed to verify differences in efficacy. Thank you very much for your attention.